Hi, I'm Takara, and this is going to be my urinary catheter insertion video for Nursing 206. A quick disclaimer, this normally comes with a plastic wrapper around it to show that it's new and also to maintain sterility, but I lost that. I'm pretty sure I threw it away by accident and I sincerely apologize, but we're just gonna pretend it doesn't exist for this video. But in real life, I would actually take it off and throw it and dispose of it, but I don't have it with me right now, so yeah, we're just gonna pretend it doesn't exist and sterility is still somehow maintained. Also, I broke my gloves during a practice round, so I replaced it with blue gloves, so yeah, I'll be using that for this just to put it on sterilely and all that stuff. Also, third of all, I know that I'm not supposed to be talking a lot during urinary catheter insertion. However, I will do it for this video because I need to be able to explain what's going on for this assignment. But yeah, in real life I wouldn't do that because it would annoy the patient. I'm just kidding. It would annoy the patient, but you know, this talking does cause particles from my mouth to go everywhere. Because I have a big mouth. I'm kidding. Yeah, sorry, I make a ton of bad jokes. Anyways, it will compromise sterility, and that isn't good because this is a sterile procedure. Because, yeah, it's it's a sterile procedure, so we don't want anything that could contaminate it. So, without further ado, thank you for listening to my ramble. But let's begin the procedure. So first of all, what I would do is, that wouldn't happen. But I would walk in the room and introduce myself. Hi, I'm Takara, and I'm going to be your nurse today. I'm here to do a urinary catheter insertion for you. But before we begin, can you please verify your name and date of birth with me? And then my patient here, Mr. Water Bottle, for now, would say his name, Mr. Water Bottle, and his date of birth. I don't know, the September 21st, 1972. And then I'd be like, awesome, great. And once I would unwrap the catheter kit. Oh, I'm gonna move it a little bit forward for room. I'm gonna use the 1-inch border to maintain sterility, rotate it a little bit more, take this off, and make sure that I place the shiny side down. Now, before we begin the procedure, Mr. Water Bottle, can I verify with you that you do not have any known allergies to shellfish or iodine? Mr. Water Bottle here would say, no, I'm not allergic to, I don't think I'm allergic to iodine or shellfish. Awesome, perfect. Now, we don't need this thing, so I'm just gonna toss it off camera. Awesome. And now I'm going to put on some sterile gloves. So, yeah, let me just make sure that you can see it. Okay, cool. I think you should be able to. Yep, you can. So there's gonna be a bit of an overlap because of limited space here, but that's okay. We're gonna work with it, right? Yeah, we're gonna work with it. Yeah, a little bit of overlap, that's okay for now. I wouldn't do this in actual practice. I'd probably give myself more room, but that's just how it goes. Alrighty then, so I'm putting on my gloves sterilely. Practicing sterile technique. I would shut up for this part, but not right now. Okay. Alright, cool. I got my gloves on. They're sterile. Cool. Now, making sure I don't contaminate my hands, I'm gonna go work with this. So the first thing I'm gonna do is basically pour iodine on the cotton balls, but I'm not actually gonna pour it because this is just a simulation. So here we go. Rip, pour, pour, pour. Woohoo! Get it all nice and iodine soaked so that way it can disinfect the patient's meatus. Woohoo! Now that it's empty, I'm just gonna eat it. Well, that didn't go in the trash pile. That's okay though. I'm just gonna move this a little bit here so that way I get myself more room. In this, there's very little room, lack of space, but this is an actual practice. So that's good, that's good. There's gonna be a little bit of overlap. Okay. I'm just gonna do this. That way it's not with the 1-inch border. It's all good. Cool. Now that this is open, I'm going to attach the syringe filled with sterile water to the port on this thingy. So I'm just gonna raise it for viewing. So stick it in there. Woohoo! Not gonna fill it yet. Fill the balloon thingy with water yet because it's not time. So I'm gonna do that. Just have that there. The next thing I'm gonna do is move this green thing, prongs, whatever, and then I'm gonna pour out the lube, you know, because we want to make sure we lube it up. So pour, I don't know, like get the lube out of here. So shh, yay, the lube's out. So now we can toss this. That landed, sort of. Okay. Now we're gonna carefully remove the blue wrapper, ensuring we maintain sterility. We're gonna pretend that didn't happen. Okay, make sure that this doesn't hit anything. Cool. All right, cool. All right, chill. Now we're gonna eat that off camera too. My hands are gonna stay on camera though, because I'm nice with it. All right. Now we're gonna lube up the first 5 to 7 inches of the catheter, if you know what. All right, so it's all nice and lubed up, and we are ready to go. We're ready to insert this into our patient now. So I'm gonna basically tuck this away in the box. It's nice and sterile for this thing. I'm gonna put this, still sterile, on top of it. And now I'm going to go to the patient. And quite frankly, I don't know how to do intimate touch principles on a water bottle. I'm sorry, Mr. Water Bottle, but first of all, I would just do intimate touch principles on an actual patient. Thank God this isn't a real one. Oh, just kidding. And just make sure that I'm applying those principles to ensure patient comfort. And then I ask what's going on. So, Mr. Water Bottle, you might feel some pressure. This might be insertion might be a little bit uncomfortable. You'll feel my touch. Do I have your consent to continue? Mr. Water Bottle would say yes. Awesome. Or I'd hope he'd say yes. He's an inanimate object, so the first thing I would do is with my dominant hand, which is my right hand for now, I'm going to use the green prongs to pick up a cotton ball, and I'm just going to go ahead. With my non-dominant hand, I'm going to go hold the meatus of Mr. Water Bottle here. So I'm going to clean 3 times, so 1, ensuring I'm not breaking sterile field. 2, 3. Okay, perfect. Now I'm just gonna throw this because I don't need it anymore, so throw it like a frisbee. Alrighty then. Now I'm going to take this and I'm going to insert it into the meatus. So, go. It just hit my glove, so that's okay. Still sterile. 1, okay, inserting. So I'm going to keep inserting until I see a flash of urine, and then insert 1 to 2 more inches. So by now there should be a flash of urine. Sterile portion is over, so I can grab this, take this, inject the contents into the thingy to fill up the balloon. Beautiful. Oh, that didn't land. Alrighty then. So normally I would like retract this a little bit just to ensure that it's in the proper place, but it's a water bottle, I can't really do that, so yay, it's in place. Awesome. And that is my urinary catheter.